I'm Doug Mueller from Mueller Prost. We are a team of CPAs and business advisors serving clients all over the U.S. Our firm has been in business for over 30 years and has offices in the Midwest and on the West Coast. Many of you are aware of HIPAA, the Health Insurance Portability and Accountability Act of 1996, which is more of a privacy act. But did you know that HIPAA added and dramatically changed the definition of medical deductions for those individuals who are chronically ill? Now, chronically ill may sound terrible, but it is primarily a definition aimed at those folks that are, say, in an Alzheimer's facility, and most importantly, a lot of folks that are in assisted living facilities. Many folks believe that if you are in an assisted living facility and not in a skilled nursing facility, that your stay there would not qualify as a medical deduction. However, HIPAA changed all that and added a category to Section 213D, Qualified Long-Term Care. Qualified long-term care would be care that includes necessary diagnostic, preventative, therapeutic, curing, treating, mitigating, and rehab services, and maintenance, and most importantly, personal care services. And those that are A, required or needed by a chronically ill individual, and B, are provided pursuant to a plan of care provided by a qualified healthcare practitioner. Now, a licensed healthcare practitioner, pursuant to that plan of care that observes the individual needs that plan of care because they flunked 2 of the activities of daily living, or they are cognitively impaired or Alzheimer types of diagnosis, then they can qualify as chronically ill. Those 6 activities of daily living are eating, toileting, transferring, bathing, dressing, and continence. If the licensed healthcare practitioner under the plan of care observes that you are in need of direct assistance or even standby assistance for a period of 90 consecutive days in a 12-month period for 2 of those 6 activities of daily living, then you are chronically ill. Now, if you are chronically ill, then all of your costs, including the food and room and board, would be a medical deduction for you that year. Therefore, it is important that you or a relative that are residing in a nursing home, assisted living, or an Alzheimer's type facility are chronically ill. You should ask for a letter from the healthcare practitioner located at that facility to provide you one for support for your income tax return. Please call us to further understand these changes and how they are specifically impacted and what you need to know to take advantage of this deduction. Join us next week when we talk about residents in independent living facilities and those with home health care. We're Mueller Prost, and we advise with vision.